Welcome back to another episode of Teeth Be Told. This is a series where we delve into all things aesthetics, oral care, confidence, and the stories behind every smile. Today, I'm joined with a special guest.
Hi, I'm Dr. Kiran. I'm a dentist turned aesthetic injector, and I now help other injectors build their businesses.
Perfect. So today we're going to be discussing all things dentistry as well as aesthetics.
Yep.
We're going to be tackling some dilemmas as well as doing a trivia. So Dr. Kiran, you've had an incredible journey starting your own business at 2017 to being a dentist as well as an advanced injector, even serving at the Global FA as a director at the SD Medical Group. Can you take us back to the beginning and what inspired you in the world of dentistry and aesthetics, and how did your journey shape who you are today?
Yeah, so I started dentistry full of hope when I started university. I thought I was going to love it. University was fine, and then I graduated.
Yeah.
And if I'm being really honest, after the first week doing dentistry, I was like, this is not for me. And nothing against any dentist, love their job. And I thought, you know what? This just is not me.
Yeah.
So I looked to train in something else, and aesthetics was there. So there was a very long period where I was doing both dentistry and aesthetics, and dentistry did serve me really, really well, and I was able to meet amazing people and grow myself. And then I moved into aesthetics and built up my own book of clients, and then landed a really good role, and was fortunate there.
How long did you do dentistry for before switching on to doing aesthetics full time?
It was 5 years. It was actually 1 month less than 5 years, and I know that because it took me 5 years to train to become a dentist, and it was 4 years and 11 months I was actually doing the job. So
how was that, the training process?
Really tough, really tough.
I can imagine.
A lot of learning, but the stress of it, and when you've got friends on different courses who are saying they're going out and they're having fun, and you're like, I've got another exam and then I've got another exam in 6 weeks as well. So it's really tough, and I look back and I'm like, I don't know how I got through that, but we did somehow.
Okay, so beauty standards have shifted so much over the years, as you know. What's your view on the current trends we're seeing now on social media?
Good question. Some of them I really like the fact that we're pulling back and we're dissolving the extremes of fillers.
Right.
I really like that, because I think we went to kind of one extreme and now we're coming back. But then we're getting the rise of things like Ozempic, things where if they're used correctly, it's wonderful, but it also puts a lot of pressure on other people who maybe it's not suitable for, and they think that it's the gateway for them to use it, and it's not necessarily the best fit.
Yeah.
So social media is great, but everything's always got to be taken with a pinch of salt. You know, it's like the new makeup trend. I might try it and it might not work for me, but injectables is a lot more. It's not permanent, but it's there. You've done something to your face, and it's not as easy to reverse.
Yeah. So with that being said, do you think platforms like Instagram and TikTok are helping people feel more confident, or are they creating unrealistic expectations?
I think it really depends on the user.
Yeah.
I really do. I think it depends on the intention that you when you switch on your phone, when you go on the app, if you can just take a second and think, you know what, I'm going to see probably 100 different men, women who are going to look different, they're going to want different things, and that's okay for them to want it, but not necessarily everything is right for me.
Yeah.
I think it's more dangerous for more kind of vulnerable people, so younger, but also the people who are more vulnerable in the population. And I think we can all be vulnerable at times, and I think there's certain times in our lives where we've all got to say, you know what, let's just pull back. Let's just not go on social media for the next week, month, or whatever. But having said that, it can be a really empowering thing as well when you kind of like
use it correctly.
Yeah, you want to use it correctly and just be brave.
Okay. So there's constant debates between natural beauty and enhancements. Where do you think the balance lies, and how do you approach this with your clients?
Definitely somewhere in the middle.
Yeah.
Definitely. I don't think there's anything wrong with being all natural. I don't think there's anything wrong with having, enhancements. And it depends on the individual. I personally like a bit both.
Okay.
I think if it makes you feel good, if you want to go all natural and that makes you feel your most empowered, confident self, more power to you, go for it. For me, I don't have the luxury of that. I need to, tap into those enhancements, so I will do that. But then I know for other people, they want to go fully down the enhancement route. I think if I get a patient coming in and they really want, head to toe, everything done, then there's something deeper going on there that we need to question and see,
100%.
Is everything okay?
Okay, so that was going to be my next question. Do you get clients coming in wanting extreme changes, how do you then balance giving people what they want while still staying ethical as well as safe?
I always ask my patients, whether it's if they want one thing, but more so when they want multiple things, how are you looking to feel after this? And if they say to me, my life's going to change and I'm going to get the guy and I'm going to get the job and I'm going to get the ring and that's a warning sign for me, because injectables can make you feel more confident, but they're not magic and they're not life-changing.
Yeah.
And if someone's looking for that quick fix, you're not going to get it from them. And I think it's my role as the practitioner to make sure that you've got realistic expectations. And often there's, more often than not, someone has said something to that person and they've got someone's made a comment about their nose or about their jaw or something. And if it comes out in our consultations and we talk about it, and sometimes we can smooth it. And sometimes I just have to say to them, I can't do this for you because I don't think we're doing it for the right reasons. And that's difficult because who am I to say that? And they're probably going to go down the road and get it from someone else. But for me, ethically, I wouldn't feel right doing it.
So you've had to turn away clients?
Oh, yeah, for sure. I turn away a lot of clients for certain treatments. And I've got many of my regular clients and they'll ask me for something else. So, they've had their Botox and they're like, oh, Kiran, what about if we just try this? And I'm like, you don't need it. Or if you're going for this look, fine. And they'll say, no, I'm not going for that look. Then we're not going to do it. How about if we do it a little bit? No. It's just not what you're looking for.
Yeah.
Because they're a reflection of me as well. And also if they go out and they're looking, the aim with these treatments is that they feel more confident and more empowered. If they go out and the result is less than perfect and then someone says something to them about it, I don't want them to then have like a complex going forward about something that, that never needed to be touched in the first place.
Yeah. Yeah, like you said, it is a reflection of, it's your work, essentially.
Yeah.
So someone could say, oh, where did you go to get it done? Like, yeah, Dr. Kiran done it. And that's not what you want.
It's not,
Yeah. Okay, so do you think the aesthetics industry does enough to educate clients about the risks and realities to these procedures? Or is it too focused on selling the perfect look?
No, I don't think it does. I think that people try, but they try to explain the risks in a way that's very self-serving. So they'll say, don't go to the person down the road because I'm the best at filler and I'm better at filler, so I can do this. And no one can guarantee that you are not going to cause an occlusion, for example. So an occlusion is where you inject filler and it blocks a blood vessel. Now, there are absolutely things that we can do to try and avoid that. And I know ultrasounds come out and that really helps a lot of people, but the vast majority of people don't have access to that at the moment. And so making a statement like that, it lulls the patient into a false sense of security.
Yeah.
And actually, I think if we just didn't do that and instead said, these are the risks, and there are the risks with anyone, and it can happen and it may not happen, and we're going to try and reduce the risk. But if it does, this is what we're going to do. I think we'd be in a better position.
So you mentioned the inclusions is a block of the blood vessels.
Yeah.
Could you explain a bit more about that? What happens then if that does happen?
Yeah, so with a vascular occlusion, you've injected a certain area, and we're injecting generally blind, so we don't know exactly where we're fully injecting. We've got a rough idea. Now, if the filler goes into a blood vessel and blocks it, then it stops the blood flow to that certain area. Once that blood flow stops, there are certain tests that we do straight after to make sure that the blood flow is still there. So we'll press on an area for 5 seconds, capillary refill test to make sure and see that the blood flow comes back quickly. If not, then we try and massage the area where the filler is, get the blood flow there. If not, then worst case scenario, we are dissolving the filler that's been placed.
Immediately,
ideally. Ideally, you find out immediately. You can have a delayed occlusion, and that might be caused by a very, again, the blood vessel has been blocked, or too much of a thick filler has been placed above a blood vessel and it's too heavy and it's just pressing down on that blood vessel and it's stopping the blood flow. If that's delayed, you'll notice a day or 2 days after, which is why as the injector, you've got to be really careful when you're doing treatments and, you're not flying out to the other side of the world the day after.
Yeah. So the risks could potentially be quite high.
So the highest risk, the biggest risk is blindness, and that's especially if you're treating the nose or the under eye area. If we block a blood vessel there, depending on the blood vessel, it can lead to blindness. So it's serious.
Wow. So the other day I saw a post about boob fillers, and the woman went a whole cup size up. They were injecting the fillers into her breast. There's also many people getting fillers injected in different areas of their bodies. What's your professional take on this? Are these procedures truly safe? And what are the potential long-term side effects to them that we should know about?
I'm really against any type of boob filler,
Okay.
bum filler, anything like that. The thing with breast filler in particular is a filler, as you know, especially the thicker fillers that will give you that volume increase. They don't always settle as perfectly as we want. There might be lumps, bumps, irregularities. So from a health perspective, because remember, we're only doing filler. This is what we call elective. It's because we want to do it. It's a luxury, right? We don't have to do it. The priority is our health. God forbid you were to have, a lump or something due to something other than the filler, cancer, for example. You wouldn't be able to tell that. You would think it's the filler, and it masks that. And I just think it's really dangerous. And I don't think enough people know about it, or I don't think enough people have thought about that side of things.
Yeah.
Because I just can't understand when you've got other options as well. And I know surgery is a bit more intense, but you don't get that kind of risk there that you're going to miss out on potentially cancer until it's too late. That to me is too high a risk to take.
Yeah.
Other parts of the body like bum filler, hip filler and things, it's that they are really risky. If we're using like huge volumes of very thick filler, and the anatomy down there, again, it's the same risk of if there's an occlusion, and people have suffered from occlusions, and you know the tissue dies and there's not much that you can do then.
Okay.
You're looking at reconstructive surgery.
So that's what I was thinking when I saw it. I said, surely this isn't safe. Like, just to think that so much product is going into that area. And like you said, you can't where you're injecting blindly, essentially, so you can't actually see what's going on. What happens then when the filler does dissolve in the breast area, or whether that's bum or hips? Where does that go?
So the filler, depending on the filler type, it normally breaks down to carbon dioxide and water. However, it depends on the type of filler.
Right.
So you've got some very, very high quality fillers that are really predictable in nature. You can say that if I dissolve this, these are going to dissolve. They're going to last generally this amount of time. The problem is now, especially in the past few years, there are so many new brands of filler and they don't have as much research behind them, but they're widely available. So there's nothing stopping you now going online and getting some of this filler and injecting. It's not illegal. You could do it.
Okay.
And I don't think there's enough awareness of actually, because people look at it, I think, from a business perspective, and they say, oh, well, this is a cheaper filler, so surely it does the same thing.
Yeah.
It probably, well, it won't, and it won't last as long, and it won't be as safe, and that's a huge thing.
What are the potential risks with going for someone that's using a cheaper filler, essentially, or the practitioner using a cheaper filler instead of the higher quality ones?
I would say that they don't know how to reverse anything if something goes wrong, and even worse than that, they don't know what the next step is, or they can't recognise if something's gone wrong. Because for me, I always have to justify my products to my patients. If I can't justify why I'm picking something, be it even if it's like a serum, an SPF, anything, if I can't justify that, then I shouldn't be using it.
Yeah.
I shouldn't be using it on someone else. If you ask your injector and they're unsure why they use it, or their only reason for using it is price, that's a red flag.
Yeah.
Because they're putting price potentially before your well-being. If they say, you know what, it's a good price and it's safe as well, then, more power to you, go ahead. But if they're putting price and, increased profits over safety, then the likelihood is they're not going to know what to do if something goes wrong.
Yeah.
And then you're really stuck.
And that's the sad thing. Nowadays, people are more so looking at profits and price as opposed to the safety of
100%.
others. Yeah.
And there's a place for it, don't get me wrong, but with aesthetics, we're not dealing with just beauty. It is beauty and it's anatomy, physiology, all the medical stuff coming into it as well. I mean, if there's an occlusion, if you go to A&E, they can't help you. A&E do not stock the reversing agent. A&E do not stock Hyalase. So if you went to A&E, they would not be able to help you.
So what happens then?
And you ask for help, and hopefully someone around has some Hyalase that they can dissolve you with.
Oh, wow. Okay, so touching more on the cosmetic dentistry side, do you think people focus more on their teeth as opposed to the health of the teeth? Yeah,
from my experience, especially now with current trends, people are... it's easier to, previously we didn't have the option of having like a cosmetic dentistry makeover, and so your teeth looking good went hand in hand with them being healthy. If they were unhealthy, then they wouldn't look so good.
Yeah.
Now we can get away with your teeth looking good without them being healthy. It's like a shortcut. And I think sometimes we forget that actually if the core isn't that great, then no matter how wonderful they look, they might not last as long as they should.
So how would you recommend educating clients about how to balance the both? Because I know obviously you don't do cosmetic dentistry at the moment.
I would say, first of all, make sure you're absolutely fine. Before you consider any type of cosmetic work, your dentist should be doing this anyway, but have a checkup. Make sure that your gums are healthy. Make sure that you've been given the all clear from your dentist. And make sure that you're going every 3, 6, however many months it is, make sure that you're going regularly. And once you've had that for a while, say for 6 months, a year, then maybe you can think, okay, let's do this. If you're prone to fillings, if you're prone to needing fillings and you've got a lot of cavities, then if you get cosmetic dentistry, it doesn't stop you being susceptible to them. It's just going to be harder and you're just going to have to pay more to reverse it.
I think that's what people think when you're getting like composite bonding, veneers, all these problems go away, but you still need to sort out the underlying issues, especially stuff like plaque is very common, but people still want to get their teeth whitened, to get composite bonding.
Yeah, I think again, it's social media. It's not all social media. I've got to be careful saying that, because when I say social media, some people use it for a lot of, like, you're using it for good, you know?
Yeah.
But I think popular treatments, people look at them and they just think it's almost like the newest handbag, like, yeah, I want that.
Yeah.
And you don't have to think about anything else, whereas actually we're still dealing with the body. So you always have to bring it back to health, whether it's aesthetics or dentistry.
Okay, so there's so much debate around veneers. Some people love them and some people say it's too extreme. Where do you see the future of aesthetics and dentistry heading? And are there any trends you'd like to see disappear or evolve?
Where do I see dentistry and aesthetics heading? I do think that there is, I don't want to say a backlash, but I think we've been really heavy on this, like, looking perfect for both teeth and aesthetics. And I think it's just starting to pull back a little bit, which I'm all for. And people, you're doing it now, but people are talking about, well, actually, let's talk about the health as well.
Yeah.
And let's not just go ahead and do these treatments just because they make us look good. Let's look for the longevity as well and how that's going to work. And are there any alternatives? And actually, what can we be doing at home to supplement this? So I think that's really good. Are there any trends I would like to see gone? In my head, I'm saying like turkey teeth.
Yeah.
I think that's the thing. Yeah, I think probably. I think with aesthetics, we've gone away from the really overly exaggerated fillers.
You think? I think some people are still doing it.
Some people still have them, but I'm seeing on social media when people have started dissolving them, then I'm like, okay, that's good. That's nice. I'm a big fan of that, because I think it puts, don't get me wrong, if an individual wants that, then okay, we can do that. But when it's a very young patient coming in and that's the trend and they're just doing it just to follow the trend, then that's not so great. So I'm happy to see that go as well.
Okay, so for someone who's looking to get fillers, bonding, teeth whitening or veneers, what are the must-ask questions they should bring to their consultation to make sure that they are making the informed decision?
I would ask your dentist or your practitioner, how many of these have you done? And
that's fair.
Your practitioner shouldn't feel offended by that. And if they do, then that's a bit of a red flag. Because I like it when people ask me that. I think that it's their body, they're taking care of themselves. Ask about the maintenance, especially when it comes to aesthetics, but definitely with dentistry. Ask about the maintenance. Okay, so if something was to go wrong, or if I was to get gum disease down the line, how easy is this to clean? So I know when I was doing dentistry, sometimes people would come in, they'd have bridges from elsewhere and it was just impossible for them to clean around them. And that's really difficult, or they'd have to probably not impossible, but they'd have to supplement their cleaning with other ways and they didn't know about it. So ask about the maintenance, because that will help you long term. Yeah. They'll probably be my biggest two. Yeah.
Okay. Are there any signs that we would see in our practitioners that would probably be a red flag for us to not go?
Yeah, if they say, if we get it today, I'll knock off £1 million.
Yeah.
Yeah, that's probably a big one. Anyone who's offering you something, or someone who says, I'll take care of it. I'll take care of it. I'll sort it. Oh, you're worried about this? Don't worry. I'll make it perfect. Like, okay. No one can make it perfect.
Yeah.
Because you just cannot. Anyone who's making these huge, big, bold promises, that's a red flag to me. Because no one can guarantee anything, right? Yeah, the price is a big one as well.
Yeah,
If they're cutting
heavy
prices,
discounts.
yeah, that's something to be afraid of. And someone who, if you speak to them in your consultation and they make you feel a bit rubbish, if you go in and you're really excited about getting, for example, lip filler, and then someone says, you know what, actually, and we can do your nose filler and we can do your chin filler and it will be great, and you feel a bit like, oh, I've had it when I had a conversation with another injector, and we were not talking about injectables at all. And this person said, I would love to get my hands on your tear trough and I could do a lovely bit of nose filler. Now, at the time, I was like, oh yeah, nose filler maybe, but I hadn't really thought of my tear troughs. And I just remember thinking, wow. And then I did get them done, not from that person, but from someone else. But I thought, wow, like, that just made me feel really rubbish. So, and that's not the person that you want to be treated by.
Yeah, because it automatically makes you self-conscious of something you weren't even thinking about.
And you know what? It's never going to end. It's never going to end because, and also I would love to know what their beauty ideal is. So who are you comparing me to?
Yeah.
And when does that stop? Because once you've done that, you're going to want to give me chin filler, jawline filler, everything else. And, you know, conveniently funding your lifestyle as well. But for me, it's not doing too much for my self-esteem.
Do you tend to find that pattern with clients that once they get one thing, they get so many others?
Do you know what? I did a few years ago. I really did. And I think that was really the peak of when social media was really had a hold on people. Whereas now I think the trend's changed a little bit and people are saying to me themselves, I don't want to get carried away. I don't want to get carried away. And that's really good because I'm like, that's fine. I won't let you get carried away.
That's great. Okay, perfect. We're going to move on to the next part of the segment, which is our dilemmas. So we ask our viewers to send in dilemmas, whether that's aesthetics or oral hygiene related. And we have a few for you to help us answer. Okay?
Okay. I'm in a friendship group where most of my friends have had some kind of cosmetic work done, like fillers, Botox, or even body contouring. I feel like I need to get something done to fit in, but I'm not sure if I really want it or if I'm just feeling the pressure. How do I figure out what's right for me? Don't get it done.
Okay.
If it's not an absolute yes, don't get it done. That's really easy for me to say when I've been in this industry and I've had people say certain things to me. It's easy to grow that tough skin. You've really got to want to do it. Otherwise, you're not gonna enjoy it. You're not gonna enjoy the results. And your friends are getting it. That's great. That's lovely for them. And you know, you can speak to them about it. And as long as they're not judging you or putting you down for not having it done, and I'm sure they're not. If they're good friends, if they're good people, they're not. They'll respect your decision. Then there should be no reason for you to.
Yeah.
I would say that from what I've seen in practice, the people who have been pressured into getting treatments by these practitioners or for whatever other reason, someone's put pressure on them and they didn't want to do it themselves, they end up regretting it. And then you have to go down the route of either living with it and not liking what you see in the mirror or dissolving it. Yeah. And I just think that's worse. So I think, you know, just if you're just honest with your friends and just have the conversation, if they're good people, they'll understand.
Yeah, I think that's the thing. Don't feed into the pressure, basically.
Which is really easy to say.
Yeah.
And it's hard to do, but I think with something, I mean, we're not talking about just, you know, trying a new, I don't know,
drink.
Or a way of doing your eyeshadow or anything like that. These are injectables, this is serious, so you don't,
Yeah. Okay, next dilemma.
Okay, next dilemma. I've been seeing so many DIY teeth whitening hacks on TikTok, like using lemon juice or baking soda, and I tried one of them. My teeth did appear whiter, but now my teeth feel sensitive and I'm worried I've damaged them. What should I do to fix it, and how can I whiten my teeth safely? You've probably damaged the enamel on your teeth, and I don't want you to panic, but that's probably what's happened. I would say go to the dentist first of all to see what the damage is done and how and the extent of it. They can assess your case and go from there. Don't try any DIY whitening hacks.
That's the thing. People seeing things online and they're just trying anything.
But it's so tempting because you've got it in your cupboard, so you're like, why not? I can save the money. But then this happens, and
especially stuff like lemon juice, it will strip the enamel.
Yeah,
off your
exactly.
teeth.
That's what's happened. So you've got acid erosion on your teeth, and that's what's causing the sensitivity.
Okay, so visit the dentist. Next dilemma.
I've been getting lip fillers for around a year now and I love the look, but I'm starting to feel like I need more each time I go to my practitioner to achieve the same result. How do I know when enough is enough, and how can I avoid going too far? At the moment, they are starting to look slightly bubbled/swollen.
That sounds painful.
Yeah, it sounds like you think that they look too big. They're starting to look slightly bubbled/swollen. That sounds like you already know that there's probably a bit too much in them. So I would say now probably enough is enough. I would also ask your practitioner, not what they think, about if it's too much, because only you can decide that truly. But what product they're using, and has it been the same product each time? Because if it's the same product, you shouldn't be needing more and more each time. If it's exactly the same product, if anything, after the first couple of mil, depending on how many mil you need, it's always there. It stays there unless you get it dissolved. The time between each appointment should be longer, and you should need less. So I'd ask how much filler you're getting and what type of filler you're getting. So it might have changed, and the practitioner might, like not have said, not maliciously, but they might just not have said. So, but it sounds like that enough is enough. And sometimes it just becomes a habit, and we keep going and getting these things.
That's the thing, yeah.
Yeah, there's a point where you just ask yourself, and I think a really good thing is if you can get an old photo of yourself and like one from today and compare the two, put them side by side and just compare and see, because we get filler blind, so we forget what's actually in our lips, and we just end up getting more.
So let's say, for example, I've been going to my practitioner and I'm getting 1 mil. Does that stay every time I go, or gradually do we reduce how much we put in?
It really depends on the person. So if you've got a higher metabolism, if we've got people who run, etc., and your metabolism's really high, likelihood is you'll break down that filler quite quickly.
Okay.
Some people just naturally have a high metabolism. Some people, I can give them a mil and it lasts 2 years later, it's still there, and it'll be the same product. So it really depends from individual to individual. Okay. Also depends the look that you want.
Yeah.
So for some people, initially they just want to start off with a very soft look, and then the next time they come in, maybe 6-9 months, they want a little bit more of a pout. So obviously then we would use a bit more of a product or the same amount, because you've got that initial 1 mil there, depending on how much has been dissolved. So it really depends from case by case, but I always think it's really good to have an initial photo. And if you don't have one, then ask your practitioner, because they should have taken before photos before they did anything. And you can ask for them, you're well within your right, and just compare yourself then.
What is it when the lips, I've seen different types of lip fillers be done, but it starts looking kind of, like she said, swollen, kind of.
Okay, yeah.
Yeah, do you know what I mean? Yeah. What is that?
Migration happens if filler's been placed in the lip and it ends up migrating, it ends up somewhere else than where it was initially intended. And there's a few ways that this can happen. So first of all, it's just the filler type. Some filler brands are more prone to it. Next is the technique. Some techniques are more likely to cause migration than others. And lastly, there's anatomy. So a person's anatomy can cause it, and there's a certain amount that no matter what technique you use or what filler you use, you will get migration. And that's the thing, that when you see people and they have like a shelf above their lips, people are getting more aware of it now and they're coming in for dissolving. That's what that is. It can also happen when you've just had filler after filler after filler, and it's just built up and it's kind of pushed the other filler up. And then I would say the best thing is to start from scratch. Just dissolve, and whether you want more or you don't, that's fine.
So would you recommend she just dissolves them?
I would say, I would say so. It sounds like it sounds like she already knows that.
Yeah. Okay, that was the last dynamic. So moving on to the next segment, we call it Truth Be Told Trivia. Okay. So we are going to ask you 5 questions aesthetics or oral hygiene related. You need to get 3 or more in order to get it correct.
Okay.
So this is going to test your knowledge. Okay, first question starts off quite light. How many teeth does the average adult have?
32, right?
Yeah. Why did you say you had to think about it?
Because I was like, are we including wisdom teeth? Are we not?
Oh, okay, yeah. All right. Fact or myth? Charcoal toothpaste is the best way to whiten your teeth.
Myth.
Why?
Because I don't think there's any research in there to prove it, so I would always say that it's not a fact unless I've got solid evidence.
Okay.
I would say it's a myth.
Yes, it's a myth. On average, how long do hyaluronic acid fillers last in the lips? There's 3 options: 3 to 6 months, 6 to 12 months, 12 months to 18 months.
6 to 12.
Yes. You know your stuff. Before we came on, I was thinking this is going to be quite unfair because you should know this anyway.
Well, I was thinking that I better know.
Yeah. Okay, so next question, number 4. What is considered the world's first recorded cosmetic procedure? Nose reshaping surgery in ancient India, breast augmentation in the 1890s, or wrinkle treatments in ancient Egypt? I can read that again if you want.
I don't know, but I'm going to say, I want to say the wrinkle treatment with the Egyptians.
No.
Oh no.
It's nose reshaping surgery in ancient India. It was as early as 600 BC.
So what, they just kind of, how did they do that without like anesthesia?
I have no clue. That must hurt, actually. Yeah.
And did the person survive?
I don't have
Successful treatments. That's what
I don't know. I've just got the questions and the answers. Okay, so last question. Which one of these snacks is least harmful to your teeth? Dried fruit, cheese, or biscuits?
Cheese.
Yeah, they tell you every time you go to the dentist. Okay, well that wasn't fair, but yeah.
80%, I'll take that. Yeah. 4 out of 5. Yeah.
Okay, so the last part of this will be the oral show and tell, or aesthetics show and tell. So we ask for each guest to bring in either an oral hygiene product or aesthetic product that they cannot live without. What did you bring?
I brought SPF.
Great.
Okay. I bought SPF, this humble little bottle, because people always come to me and they say, Kiran, what is the best cream? What is the best injectable that I can have that's going to stop me aging? And they're looking for something that's £100, £200, £300. And I'm like, go to Boots, Superdrug, wherever, and get at least a factor 30 SPF, and it will. And the number of people, you know, who are getting Botox, fillers, etc., but they're not doing the basics, and you're just wasting money because you're not looking after your skin, and this will prevent so much damage. It will prevent, yes, fine lines and wrinkles, but also for the health of your skin. So this is and I will keep saying this until everyone who comes into my clinic says, yeah, I'm using SPF.
Yeah. But you know, a lot of people don't realise that they need to be applying it whether it's hot outside or not.
Yeah.
People just think it's when I'm on holiday or something, then I need sunscreen. But
yeah, so even if I had, that's really interesting actually. I had a virtual consultation on last week, and the client that I was speaking to said, you know, I'm only in the house, so I don't need to wear it today. And I was like, no, there's windows, and also make sure you're putting on enough. So it's got to be like two fingers widths, right? So you need to feel that, and it's a lot, but just do it. Just do it. And you can see if you can get some skin scanners now, and when they assess the health of your skin, you can see the UV damage. So and it's quite shocking, and you can tell the people who haven't.
So what are some of the benefits for those that aren't aware of SPF for the skin?
SPF can prevent, obviously, avoid UV damage, but it can also prevent things like pigmentation. Reduce your risk of skin cancer as well. But pigmentation, especially for patients with skin of colour, if you're more prone to get pigmentation, use SPF. That's the first thing I always ask. Pigmentation is such a huge problem, and you can avoid it by religiously using SPF. Obviously, there's some types of pigmentation that are just going to happen, but we can really try and help reduce it with this, and it helps your skin health as well. So it's a no-brainer for me.
Perfect. I've actually started using the La Roche one as well.
It's good,
I was using
it?
Bondi Sands, and then the report came out about how it's actually no good.
No good, yeah.
Yeah.
I've been using this. I'm going to switch to Korean. I'm having a little dabble with Korean skincare at the moment.
What's your thoughts on Korean skincare? Because it's worked for some people, and some people saying it's not good.
I put it off for ages. I've used medical grade skincare for 7 years. I put it off for ages. I thought it was another fad. My skin loves it.
Okay.
My skin absolutely loves it. But with anything with skincare, there are some brands that my skin might love and yours might not, and vice versa. So it really depends. I would say the good thing about Korean skincare now is that you can just pop to your local Boots or wherever and just get something pretty cheap and cheerful and see whether your skin likes it, and if it does, great. If not, fine. And I think that for a lot of my patients who were previously on medical grade skincare but wanted something a little bit cheaper, or they want to swap a few products out, it's giving them that option. The formulations are really good. Obviously not all are perfect, but a lot of them are really good.
That's good. Okay, so last question. As a dentist, what's your daily oral care routine?
Wake up, brush my teeth,
Yeah.
and then go out throughout the day. I don't really have too many fizzy drinks, to be honest. It's just not my thing.
Yeah.
And I do have a lot of tea and coffee, but I don't have any sugar, so that's pretty good. And then at night, floss, mouth rinse, and then brush. And people always say, wait, you're supposed to brush first and then use the mouth rinse.
Yeah.
And I don't know, people might hate me for this, but I remember specifically being in a lecture, and I was told, if you floss and then run the mouth rinse through it, so you're obviously, and then you brush and you remove the plaque. If you use a mouth rinse after you've brushed, you just get rid of all the toothpaste. Yeah. Or the other option is to wait, 15 minutes and then use your mouth rinse. But I'm in bed by that point.
What's your take on not rinsing after brushing your teeth?
You're not supposed to.
Yeah.
Yeah.
But why?
Oh, because you get rid of all the toothpaste that's left on your teeth. You'll get rid of it. So all the benefits that you're receiving from it will just literally go down the drain. So if you can hold it onto your teeth for as long as you can.
Is that what you do?
Yes, that is what. And I found it really difficult first.
Yeah.
Because it tastes horrible. It doesn't taste great, but you get used to it.
Okay, that's good. Okay, before we wrap up, Dr. Kiran, can you leave our audience with 3 top pieces of advice, whether it's oral care, aesthetics, or confidence?
I think for both aesthetics and oral care, don't go with trends. Try not to follow trends.
Right.
Make sure that it's right for you. Secondly, always make sure that your practitioner, be it dentist, be it hygienist, or be it aesthetics practitioner, is right for you. Of course, they'll be trained. We hope that everyone is trained appropriately, but make sure they're right for you. Don't just go with someone just because, whatever reason. Make sure they're right for you. Lastly, just make sure you've got a good routine yourself. So whether it's oral care or skincare, make sure you've got a good routine yourself that's solid and in place before you start adding on cosmetic dentistry and veneers and all the rest. And the same with injectables. Make sure that your routine is sorted and you'll be in good stead.
Perfect. That's the end of it. I've been your host, Nadesh. Thank you for tuning in another episode of Truth Be Told. And this has been
Dr. Kiran, thank you.
We'll see you on the next episode.